Okay, we're gonna go ahead and get started. Roman Basie could not make this webinar, so he put me in charge instead. Thank you for being here. And I'm an attorney with the Center for Financial, Legal, and Tax Planning, and I'm here to talk to you about the American Health Care Act. I'm going to go over the basics. This is touted to repeal and replace Obamacare. We're going to talk about the elimination of the mandate for employers, employees, and individuals. We're going to talk about the elimination of certain taxes, the effect of Medicaid, the effect on small businesses, the medical excise tax. We're going to talk about a few other items that have come up. And we're going to talk about the MacArthur Amendment and pre-existing conditions and Fred Upton. The current status is that it passed the House on May 4th, 2017. First of all, Section 204 eliminated the individual mandate. That was not very popular, and it remains to be seen how far this bill will go. Section 205 is the employer mandate. In the AHCA, the employer mandate will be eliminated as well. Section 206 is it refers back to the Cadillac tax. And that particular tax is, I believe, has not been worked on. That applies to healthcare taxes, healthcare plans that are $10,800 for an individual and $21,000 $29,500 for a family plan. That is paid directly to the insurance company of 40%. Also, Section 213 of the Act eliminates the Medicare tax. That is on upper income of $250,000 for married filing joint and $200,000 for single people. That was the 0.9% tax. This act, sections 111 and 112, get rid of the Medicaid provisions, and it is a repeal of the expansion. With the current ACA, those making under 138% of poverty are eligible for this. Under the new act, which has passed the House of Representatives, it undoes that and it brings it back down to poverty level. So it is pretty draconian in that respect. The small business tax credit, which kind of surprises me because both Democrats and Republicans are pro small business. They removed this provision where small business owners under 50 employees can buy insurance for their employees. That will be gone. The medical device excise tax, that has never been implemented. It would go on next year, but this would effectively eliminate that provision. The repeal of the tanning tax, that is a 10% tax currently on anyone getting a tan. Many tanning salons have attempted to evade this and bundle their services. And the IRS has audited a lot of tanning places, and they have found that either they haven't collected the tax or they're not doing as they should. What's commonly known as the net investment tax, that is a 3% tax, and it can affect the middle class. Generally, if you sell a home and it props up your income, this can affect you. It's 3.8%. Under the American Health Care Act, it is retroactively taken off. Let me see when that applies. It applies to January 2016. Any sale after that. On the bright side, the American Health Care Act does give a tax credit for healthcare plans, and if you are under 30 at the beginning of the year, it is $2,000. If you are 30 but not yet 40, you're looking at $2,500. If you're 40 but not yet 50, it is $3,000. And if you're 50 but not 60, $3,500. And if you're 60 and above, or 60 to 64 technically, it would be $4,000. And of course, if you're 65, you qualify for Medicare. The MacArthur Amendment and pre-existing conditions. MacArthur, I believe, had a good intent, but I think it was a really lousy ending to what could have been a good amendment. He tries to protect those with pre-existing conditions in a way in which it would offer a waiver available to the states if they can set up a better system and have a high-risk pool, then they would be allowed to do so under a waiver. We really don't know how that would work because generally high-risk pools are a lot more expensive, of course, than they would be for the better health individuals. So you could be looking at a 5 times difference between a healthy individual's rates and one with pre-existing conditions, and there are no payment or no income provisions in this current, I guess it would be a bill. So that would be a significant detriment to those with pre-existing conditions. And there was a last minute holdout, Fred Upton. He's from Michigan, and he introduced another $8 billion to the Medicaid provisions of the AHCA. A lot of experts think that the pool for Medicaid should be more like $200 to $300 billion funded, but right now, as it stands, it is about $128 billion to $136 billion to prop up the Medicaid. We don't think that's necessarily going to be sufficient, but it has to go through the Senate, where it will likely face a lot of revision. Thank you for attending. If you want to give me a call, there's my number right there, or my email, and you can see us at taxplanning.com. And we also do a tax tip list. That is where we write on various tax issues. We hold a once per month webinar, and we also are on social media, and we do blogs as well. So I would invite you to come and see us if you like, and that should do it. Thank you.